have a patient here. His name is Steve, and he's a 48-year-old gentleman from Des Moines who visited with me a couple months ago to talk about hair transplantation. And Steve has actually had a strip method of hair transplantation about 10 years ago. So he's going to tell us a little bit about that experience and kind of what brought him to Des Moines Plastic Surgery to talk to us about the hair transplantation procedure. So Steve, tell us a little bit about yourself and what brought you in.
I'm a 48-year-old married man with 2 beautiful kids. I work at a major hotel here in the Des Moines area, and I guess why I'm here basically is because hair loss has been a major concern of my life pretty much since my early to mid-20s is when I started really noticing the hair kind of dwindling away. And I always wanted to do a hair transplant procedure, and eventually I finally got enough willpower. I don't know if you want to call it willpower, but it finally got enough courage
Yeah.
to do a hair transplant. And
That was about 10 years ago?
About 10 years ago, before the NeoGraft was around, so they had
Right.
the strip method, which obviously you're very familiar with. It was a very painful and long recovery. Even to this day, almost 10 years later, I still actually feel the scar back there, and it's very itchy.
Can you see the scar at all?
If my hair is cut too short, yes, you can. So I always, whenever I get a haircut, I got to make sure that it's not cut below a certain length, because
And so one of the things that we talked about in your consultation when you came to see me was the big difference between the way the 2 procedures work. And with the strip method, a lot of patients will they'll say that the grafts were fine, their hair grew and everything, but they complain about a painful scar or a visible scar, and they're always dictated by how short the hair can be because of the fear of seeing that scar. So those are obviously things that you experienced. And you also mentioned this is something that you've always wanted to do. Doesn't bother your wife, or this is something that's always, as a guy.
My wife loves me, my kids love me. It's something within. I can't explain it, but the way I look at it, if there's something out there, if there's something that bothers you out there, and there's a way that you can fix it, well, why not just do it? And now with this new NeoGraft procedure, it's just exciting to know that there's a hope that this can be fixed the way I would like it.
So tell us the areas that we're going to address. I mean, we went through this in a formal consultation, but just your understanding of the areas that you want to get filled. And
well, I'm a tall guy, so I have some balding, in the back area. I guess the crown area is what it's called, but. Yeah. The frontal area here is where I really like to see it puff up, because I used to have a cowlick, and I want that cowlick back.
Right.
That's my goal.
Yeah. So typically, like we talked about, we start with the frontal hairline first, and then we work our way backwards, and we make it pretty dense in the front, and then go in the back and fill the crown. But 3,000 is gonna give you a nice density and a huge correction. And also, as we had talked, the hair that is transplanted is actually genetically different than the hair that you're pre-programmed to lose on the top of your head. So that hair will never fall out, and it'll grow, and it'll take about 95% take of the grafted hair follicles, which is wonderful, and that will grow over the course of 6 to 12 months. That new hair transplants will grow just like normal hair. So it's an exciting procedure, and we're looking forward to getting you all done.
I'm looking forward to no more sunburns on the top of my scalp, because that's very painful.
Yeah.
Especially when it peels, it doesn't look too good. So that's one of my goals.
We'll cover that skin up.
I'm looking forward to it, Doctor.
Yeah, well,
definitely.
Good. Well, thanks for meeting with us today, and we'll see you on a future video as we get closer to your procedure.
I'm excited. I can't wait.
Okay.
Thank you, Doctor. Yes.
Yeah.